What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll be covering the difference between being a nurse and being an X-ray tech. So to give you some context, because I know you're like, Miguel, are you a nurse or yet? So I am an X-ray tech, graveyard shift, been doing it for a few years. I work in an ER trauma 3. My lady, she's a nurse. So yes, I do know the difference because every single day. I've known her since she was in nursing school. So I was there since the beginning. I've heard all the stories and all the struggles of being the nurse. And she knows not as many for me because being an X-ray tech, it is more easier than being a nurse. Like, just hands down, it is. The only difference, you will get paid like just basic X-ray versus being a nurse. I'm talking about nurses do get paid slightly more than us, depending on the level of, like, if you're just a LVN, if you are RN, if you're BRSN. Of course, also like in our X-ray field, if you're like X-ray, CT, nuke, like different levels, of course you'll make more money. But like just the basic RN versus the RT, the RNs do make slightly more money than we do. But the amount of work and responsibility is, like, I would say almost triple or even quadruple as much compared to us. So I think if I was a nurse and I saw what X-ray does, I would almost be mad, because I'd be like, so you tell me for a few less dollars, I could be less, like I am less stressed than my lady is every single day. Like, I'm talking about, the only thing that stresses my department out is, are we having some maintenance on like the portable? Are we having, like, is the system down and we have to manually input everything into our packs or onto our thing where we edit and stuff? Like, that's about it. Or is the good portable down? Are we gonna have to bring everyone to the department? Like, there's little, that's about it. Or are we having a bad doctor, the ones who are, like, that's it. Nursing, you have so many, you have to be on top of all the drugs, all the medications, multiple patients. Like, the charting, our charting, you know what, like if you're like, okay, Miguel, what's the difference in your charting versus the nurse's charting? The nurse's notes can range from like this much to like this much of just constantly updates on the patient, what medications, what allergic, have they contacted family, like, are they cleaning their butt, are they doing like all this. Mine, chest pain today, or cough today, or patient unable to do this and that, unable to get optimal picture, because, like, that's it. Keep it pushing. Like, literally, that's it. Or like if you're in the main, maybe the consent form, or they're allergic to this. Or if you're doing, like, the most medication we deal with is in the main, which would be gastrografin, barium, lidocaine for like the hip injection stuff. That like, you could probably count all the medications on your finger. Versus being a nurse, you have to know all the drugs basically that your person is on, using, if you're allergic. So many medications. I asked my lady so many times how she keeps up, because there's some drugs that sound the same. They're like there'll be like one or two difference, and they'll make a huge difference between like what it does and how it can affect, like, big. And then also the dosage amount. Like in ours, it already comes like an X-ray already like, let's say it's barium. It's like this. Or you have the baby one that's like this, and you just put water. That's it. There's no math involved, or like, not really in that. Maybe if like on like lidocaine, or like, well, the RP does that, but like not that much. We don't really have to worry about that. Versus the nursing, depending how much the patient weighs, you can give so much drug of this and that. Like, it is very more harder to be a nurse. And my respect to the nurses. Whatever my lady wants, I will give her. Like if she wants food, I'll give her whatever she wants. Cause like I tell her every single day, I see her, I respect you, but I could never be a nurse. I could never, cause like it is hard. I see these poor nurses in my hospital working, and they be like, and then they'll be coming to our department to ask us questions, and we just be there chilling, cause like we did all our work and we're just chilling like a sup. They come every day and they're like, I wish I would have pushed the button, Miguel. And I'm like, you still can. You still can. But and she's like, I've already spent hundreds of thousands of dollars on my degree. And I was like, well, couldn't be me. I ain't saying it's bad being a nurse. Of course you need nurses. Of course you need... And there's people who like that. I'm just saying that it's harder than being ours. Now, if you do CT, that could be... I would compare to a level of being a nurse, because you do have way more involvement with the patient, because you have to inject contrast, you have to make sure their creatinines and all that other stuff are good, and have they had allergic reactions and stuff. It gets very complicated as far as like the job day to day, and it's very detailed. That can go over the coverage on the actual schooling difference on another video, because it could take super long. It's harder being a nurse going through nursing school versus ours. Ours is hard too, but theirs is just like a whole nother... I'll make another video on that one. But to summarize it short, it's easier being an X-ray tech versus a nurse. As far as... It is more rewarding, though, being a nurse, because you take care of the people. We just kind of assist as X-ray techs, but it is way more harder. So that's kind of a gist of what to expect. And yeah, it's been your boy Miguel. See ya on the next one.